Today I'm very happy to have with us Dr. Nikhil Jain, DNB, ENT and Head Neck Surgery. Dr. Jain, thank you for joining us here. आपने अपना वक्त निकाल के हमारे साथ, हमारे पब्लिक के लिए, मदद के लिए आप आज यहाँ शरीक हुए. बहुत बहुत शुक्रिया.
Thanks for having me here. It's my pleasure to be here at Dr. Saab.
Thank you. तो बहुत सारे सवाल मैं आपसे पूछूंगी, but I think I want to start with the very basic question. Ear, हमारे कान के भी 3 parts होते हैं शायद, inner, outer और शायद एक और होता है.
So the outer, middle and the inner.
Yes, outer, middle, inner. तो मुझे सबसे पहले जानना है ये तीनों इन्फेक्शन अलग-अलग होते हैं या or is it a part of the same treatment plan?
When a patient tells about the ear, तो जो उनको दिख रहा होता है तो उनको कान एक दिख रहा होता है. But ideally, yes, it is into 3 parts. The outermost जो हमें दिख रहा होता है बाहर से. Then the middle जो पर्दे तक होता है, that is the outermost. पर्दे से लेके सुनाई की नस तक हम उसको बोलते हैं the middle compartment. So that is the middle ear. And beyond the middle compartment is the inner ear, जहाँ से actually हमारी hearing nerve का compartment शुरू हो जाता है. So all the 3 compartments, they can have different set of infections. The most exposed obviously is the outermost ear, जिसको हम बोलते हैं पिन्ना. जो पिन्ना के अंदर जो रास्ता होता है जो कि पर्दे तक जाता है उसको हम बोलते हैं केनाल, ईयर केनाल. एंड फिर पर्दा, तो पर्दे तक जो है वो आउटर ईयर है, विच इज़ द मोस्ट एक्सपोज, द आउटरमोस्ट पार्ट विच इज़ द मोस्ट एक्सपोज टू एक्सटर्नल एनवायरनमेंट, टू इरिटेंट्स, टू डस्ट and even to bacteria exposure and exposure to water. So when a patient presents to us with you may call like one symptom, if we take pain, so the pain can be at the outermost part also, it can be in the middle ear also, right? So and जहाँ तक infections की हम बात कर रहे हैं कि infections कैसे हो सकते हैं, तो it can present in a varied form. Most common presentation is pain, जिसमें patient urgently डॉक्टर को याद कर रहा होता है. फिर कुछ टाइम बाद कुछ पेशेंट्स जो हियरिंग लॉस कंप्लेंट करके भी प्रेजेंट कर रहे हैं. तो दैट इज व्हेन द इनर मोस्ट पार्ट ऑफ द ईयर गेट्स अफेक्टेड विद इन्फेक्शन.
ओके, तो सबसे फ्रैजिल पार्ट कौन सा होता है और कब ऐसा होता है कि ये वाला सीरियस पार्ट? एक कान का दर्द बहुत कॉमन चीज है, लेकिन कब मुझे ये सोचना है कि अब ये सीरियस है एंड आई नीड टू कंसल्ट अ डॉक्टर इमीडिएटली?
कान का जो इन्फेक्शन की हम बात कर रहे हैं, तो most serious thing which actually rings our head is when the patient presents with sudden loss of hearing. See, hearing loss over a period of time, it's still it's a gradual onset loss. हम उसको ये लेके चलते हैं कि शायद सुनाई की नस में शायद कुछ कमजोरी आई है with a period of time. It has to be addressed, but there's no urgency, immediate urgency related to that. But yes, it should ring our heads when patient presents with immediately कि डॉक्टर साहब मुझे 2 दिन से जो है मेरी एकदम hearing dip हो गई है. And especially we say that when the hearing affects one ear and while the other ear is totally okay. So that can be one infection, most commonly a viral infection of the ear, or it can be more things related to that. Some blood vessel might have got blocked. Again, the etiology that we associate with such sudden loss of hearing is again first and foremost is infection only. So it can be through the nose to the ear. It can be viral infection which has happened from the outer ear to the inner ear. A discharging ear which has the toxins have gone inside to the inner ear. So the most alarming part is when a patient presents to sudden loss of hearing. और जो symptoms होते हैं जैसे कि pain है, when infection ensues. So there can be pain, there can be a discharge from the ear. Oral fullness, कान गुम होना, मेरा कान बंद लग रहा है, भारी लग रहा है. So presentations बहुत अलग-अलग तरीके से हो सकती है. सबसे अच्छी बात ये होती है कि the easily manageable is there is pain in the ear, which is a sudden onset pain, which we think would be from the outer ear. The cause is outer ear only. When we look into that, we examine the ear. So there can be swelling in the outer ear. When we examine further, there can be swollen middle ear, the eardrum can be swollen. इसको हम tympanic membrane बोलते हैं medical language में. And when we see that everything is okay, then we look further into the cause कि beyond the middle ear, inner ear कोई infection तो नहीं आ रहा, जिसमें कि और भी varied cause होते हैं जैसे कि पेन के साथ हियरिंग लॉस, साथ में चक्कर आ जाना. So then that is actually something really grave that we are dealing with. तो
Okay.
उसमें हम पेशेंट को फर्दर इन्वेस्टिगेट भी करते हैं.
अच्छा, तो मतलब हेयरिंग लॉस के साथ साथ
There is pain
पेन एंड हेयरिंग
along
लॉस
with along with dizziness.
along with dizziness.
Patient
Yes.
presents with
Ah.
lightheadedness, dizziness, and all the triad which the patient presents with. Some patients even complain of tinnitus at the same time. So जब inner ear infection की हम बात करते हैं तो then we have to actually get into the detail कि inner ear भी affect हो गया है, which is actually something serious then.
ओके ओके, तो आपने बोला कि ऑफ कोर्स आउटर ईयर इज मोर एक्सपोज टू एनवायरनमेंट एंड इरिटेंट्स, तो वो कॉमन होता है. बट व्हेन द इन्फेक्शन रीचेस द इनर ईयर which can result into dizziness also, along with pain and hearing loss.
Yes.
Now that is something which is alarming and should be consulted at the first chance
Immediately
possible.
and on a very serious note, it should be then and there only.
ओके और कई बार ये मेरा पर्सनल एक्सपीरियंस भी है और बहुत सारे लोग मुझसे ये कंप्लेन करते हैं कि जब हम फ्लाइट में बैठते हैं, जिस टाइम पे या तो फ्लाइट टेक ऑफ हो रही है या फिर जब लैंड कर रही है, तो जो ऑल्टीट्यूड चेंज की वजह से कानों में बहुत ज़्यादा वो नमनेस आ जाती है. और कई बार ये नमनेस तो उसी टाइम ठीक हो जाती है कुछ मिनटों में.
True.
और कभी कभार ये नमनेस बहुत वक्त तक रहती है. जैसे मेरे साथ एक बार हुआ था, जब मुझे ये नमनेस आफ्टर आई लैंडेड बैक फ्रॉम द फ्लाइट, इट कंटिन्यूड फॉर अ फ्यू डेज एंड आई वाज वेरी सरप्राइज्ड विद दैट फैक्ट. उसमें हेयरिंग का भी प्रॉब्लम लग रहा था, नमनेस भी
True.
थी और पेन भी बहुत था.
So आप barotrauma की बात कर रहे हैं. Barotrauma. So barotrauma, baro means pressure, trauma means change of pressure की वजह से चोट लग जाना. तो चोट लग जाना is actually something which is last sequelae कि इतना तेज pressure change हुआ कि पर्दा ही rupture हो गया. That is called that the entire thing is called as barotrauma. जब हम pain की बात करते हैं या fullness की बात करते हैं, जैसे कि जब flight, especially when the flight descends, so there is people complain of abrupt pain and when the flight starts descending, so there is a sudden change of pressure in the air. The ears, they take time to adjust to. There is a pressure equalizing tube which connects the ear with the airway, that is the nose. So this pressure equalizing tube, उसका काम ही यही होता है कि whenever there is a change of pressure, the pressure transmits through that tube, through the nose to the ear. If there is a good transmission, we do not come to see any symptoms. It's okay. We don't feel anything that has happened. But when the tube is, there is a sudden change of pressure, even then it takes time to adjust. Or if there is infection in that tube, suppose कोई long standing URI है, सर्दी जुकाम चल रहा है, so then there is inflammation in that tube called as a eustachian tube, जो मैं प्रेशर इक्वलाइजिंग ट्यूब की बात कर रहा हूँ, पीई ट्यूब की बात कर रहा हूँ. तो उसमें इन्फ्लेमेशन हो जाती है, उसमें स्वेलिंग आ जाती है, तो इट टेक्स अ व्हाइल टू एडजस्ट टू द एक्सटर्नल एनवायरनमेंट प्रेशर. But the flight is descending or ascending, it's actually a very small moment that the pressures can be adjusted to, and फिर वहाँ पर जो है oral fullness immediately, pain होना, even sometimes rupture to the eardrum, especially if we are having upper respiratory tract infection. जैसे हम फ्लाइट की बात कर रहे हैं, तो ऐसे ही इवन द डीप सी डाइवर्स वो भी अफेक्ट हो जाते हैं. तो आई हैव रिसेंटली हैड अ पेशेंट हु एक्चुअली वेंट फॉर deep sea diving, and she came to me with ruptured eardrum, and to my surprise, I actually not very many patients come to us with the ruptured eardrum while deep sea diving or while flying. It's a very rare incident that we come across, but it took me a while to realize and I had to ask a couple of questions more to her to
ascertain the cause
to a certain and I thought that she is trying to hide up the cause. Some trauma must have happened, some physical trauma. She's not willing to tell me or open up with me. But then she actually had been going to deep sea diving, and in one of the episodes she had this ruptured eardrum.
दिस इज द फर्स्ट टाइम I've heard एंड ये फ्लाइट का मैंने सुना था कि जब फ्लाइट असेंड और डिसेंड होती है तो काफी बिकॉज ऑफ द चेंज इन द प्रेशर आपको ईयर पेन हो सकता है, लेकिन डीप सी डाइविंग या स्नॉर्कलिंग के वक्त पर भी आपने
True.
बताया ईयर ड्रम रप्चर होने की पॉसिबिलिटी है.
True.
सो अगर ये दोनों में पॉसिबिलिटी है, क्या एज अ ENT सर्जन कैन यू सजेस्ट समथिंग दैट कैन प्रिवेंट?
So I always tell my patients who come to me that Dr. Saab, हमें frequently whenever we take the flight, we have this earache which is really bothersome, and personally I also have earache whenever the flight is descending. So what I follow is when we realize that the flight is descending, I start picking up voluntary yawns.
Okay.
You open up your mouth, take a yawn, and so that you deliberately try to equalize that pressure in the tube.
So when you yawn, you are pushing the air out of your.
So we are pulling up air
Pulling up
and trying to push that air through the nose towards the ear, and thereby opening up that tube, which otherwise would have caused vacuum in that tube, and the pulling up of eardrums due to vacuum would cause earache. So to prevent excessive earache or any bad episode, you can just pull up air as a voluntary yawn, and then you can prevent
breathe it
that.
out. Breathe it out through
Not
nose.
breathe it out. You can just breathe it out through the nostrils. Pull up air, breathe it out through the nostrils, and it will a part of it will go into the ear and would equalize that pressure. One thing. Then another thing is people say that you can start chewing gum while you're in the flight. Another is when somebody is actually having nasal blockages or URI symptoms, upper respiratory tract symptoms, and they have to take up the flight. So before boarding the flight, they can use some nasal drops a few minutes before they board the flight, and when they descend in a longer flight, before they descend, they can again put those drops. So it will transiently keep that passage open and would not lead to immediate vacuum creation and would sucking of that eardrum inside.
So the ENT hack that we have learned today to prevent our ear pain whenever we are in the flight. I think there are three that Dr. Saab discussed with us. First is to have voluntary yawn when you are descending from the flight. Pull in the air from the mouth and breathe out through the nose.
I mean, anybody can try that, doing that. It's not like something which is unimaginable. If we usually have involuntary yawns, we can also have voluntary
yawns. Okay. Second, we can try chewing a gum while we are descending, and the third one is to use nasal drops.
Use nasal drops. You can start with saline drops. If it doesn't help, then decongestant nasal drops are also available. So of which the use should be very judicious, only at the recommendation of a doctor. Otherwise you can safely use saline nasal drops.
Lovely. Thank you. I think बहुत सारे लोगों को आज मदद मिलेगी आपके इस हैक से. Thank you for sharing that with us.